Hey everyone, today I'm diving into something really important, the side effects of Diclofenac. This is a common medication used to relieve pain and inflammation, but like all medicines, it has its downsides. First up, gastrointestinal issues. You might experience stomach pain, nausea, or even more serious things like ulcers or bleeding. If your tummy's troubling you after taking Diclofenac, it's time to chat with your doc. Next, let's talk about cardiovascular risks. Diclofenac can increase the risk of heart attacks and strokes, especially if you're on it long term. If you have a history of heart problems, this is definitely something to consider. Now, on to liver and kidney effects. Diclofenac can affect how your liver and kidneys function, sometimes causing damage. Look out for symptoms like dark urine, yellowing of the skin or eyes, or unusual fatigue. If these pop up, you need to seek medical advice ASAP. Another side effect to be aware of is skin reactions. Rashes, itching, and even more severe reactions like blistering can occur. If you notice any changes in your skin, stop taking the medication and check in with your healthcare provider. Lastly, some people experience headaches and dizziness. If that's you, it might be worth discussing alternative pain relief options with your doctor. So those are some key side effects of Diclofenac to keep an eye out for. Remember, this isn't an exhaustive list, and not everyone will experience these issues. Always take medication as prescribed and stay in close contact with your healthcare team. Stay informed, stay healthy, and don't hesitate to ask questions. Thanks for watching. If you found this helpful, give it a thumbs up and share it with anyone who might benefit. See you next time.